Well, it's been called a crisis on campus, a major uptick in the need for mental health services at universities.
The I-Team's Casey Geraldo found out in addition to resources being stretched thin, some students say they're too stressed out and too busy to get help. Casey.
That's right, George and Carol. The counseling services at the University of Wisconsin-Milwaukee has grown so much it had to move to another building. The center sees more than 5% of the entire student population each year, but the number of students who feel like they need help is likely even higher. It's something we all grapple with every day.
Multitasking is not only accepted within our society, but it's something that we value.
For college students, it can be especially daunting. University of Wisconsin-Milwaukee graduate student Lindsay Lipson says she was overwhelmed as an undergrad.
Taking tests, having to write huge papers all the time, a lot of internship hours to complete. So it was all that, and then I had relationship struggles.
People say you shouldn't be working as much if you have so-and-so credits, but it's a little hard too, especially if you're living on your own.
Data shows the do-everything mentality is spiking anxiety and depression on college campuses.
Close to 60% of students in the previous 12 months felt so anxious they had a hard time functioning.
The Center for Collegiate Mental Health at Penn State University gathers information every year from 139 counseling centers. They say use of counseling centers on campuses went up by 30% from 2010 to 2015. The number of students seeking mental health treatment went up 50% from 2015 to 2016. The demand is also rising locally. Paul DuPont from the University of Wisconsin-Milwaukee says over the same 5 years, the number of students who went through counseling went up 35%. He tells the I-Team the cost of higher education is one added stressor. A group that studies the cost of college estimates the average debt for a 2016 graduate was more than $30,000.
It puts an awful lot of pressure that they have to do well in college, perform well, sometimes get involved in lots of things that are going to increase the chances of them getting a job.
And DuPont believes our society is more stressed as a whole. The American College Health Association says added stress is outstripping our nation's universities' capabilities to deliver the care students need. DuPont says UWM has gotten creative to help meet increasing demand. They've trained hundreds of staff, students, and teachers in suicide prevention. Counselors now hold 20-minute consultation sessions around campus to help students who just need a little advice or guidance. And the center schedules appointments by urgency to address highest need students first. As accessible as the university makes services, students like William say counseling might help, but she's been too busy to try it.
I mean, if I did have the time, I probably would.
But Lipson says getting the help is worth the time.
Regardless of the stigma, people really do need to seek services.
DuPont believes helping young adults focus more on their efforts rather than their outcomes could help relieve some stress. And the American College Health Association is holding a national symposium on the growing demand for mental health services later this month on the 13th.
You know, Casey, it seems like this starts so young now. Did DuPont have any suggestions for those of us who have younger kids?
Yeah, there's always stuff that you can do. And he says for younger kids, learning to incorporate relaxation and fun into their lives is really important. He says for kids, that means playing without a focus on improving their skills or learning anything. And he says for adults, mindfulness might be the answer. A lot of people are talking about that now. And just making sure that your week includes activities that you enjoy and taking time out for yourself and checking in with your emotional well-being.
Mental health is as important as physical health, and we keep forgetting that.
Absolutely.
So very good. Thank you,
Thanks,
Casey.